Hello, my name is Sabrina, and I'm an advocate of HeartSense. Today, I'm excited to host a fireside chat with the co-founders of HeartSense, Dr. Antoine Keller and Brooke Everett. Dr. Keller and Brooke, welcome, and thank you so much for joining me today.
Thank you very much, Sabrina. It's so nice to be here.
Yes. And Brooke, welcome. Thank you for joining.
Thank you for having us.
Yeah. So let's get started with the questions. So February is American Heart Month. What is American Heart Month for the community to know? And why is it important to HeartSense, the organization, and to you personally? So let's start with Brooke.
So thank you, Sabrina. February is American Heart Month, a time when all people can focus on their cardiovascular health. We promote American Heart Month by wearing red the entire month. It's important to HeartSense as we are a organization in the community who promotes heart health and tries to help the people in the community be aware of their risk factors for heart disease and stroke.
Great. Dr. Keller, do you have anything to add?
Yeah, American Heart Month is significant because of the fact that we get to accentuate these kinds of issues. You know, heart disease is the most common medical problem in America, and more people die from heart disease every year than all types of cancer combined. So it's really important for us to bring it to top of mind for people, not only during February, but every month as far as I'm concerned. But February gives us a good platform to be able to talk about those things.
That's great. Wow, I can't believe all cancers combined, this is still the #1 killer.
Yeah, you know, oftentimes I'll have patients in the office and I will ask them if they had to have something bad, heart disease or cancer, which one would they prefer? And almost invariably they say they would rather have heart disease because they don't want the big C. But then I tell them that heart disease kills more people than all types of cancer combined, and they have second thoughts about that. So many types of cancer these days are curable. And heart disease, though, is progressive. So if we identify it early and we can slow the progression, then that's the most valuable thing. And the only way that we can do that is by educating people. So that's what we're here to do.
Wow, so American Heart Month is super important to all of us, especially with what you just mentioned, Dr. Keller. Okay, moving on. So is HeartSense during American Heart Month partnering with anybody? Like doing any kind of support for other movements that other organizations might be doing? We'll start with Dr. Keller.
Yeah, we have a couple of partners that we have encountered along the way that we would like to mention. One is Echo Health, and they make digital stethoscopes with artificial intelligence that allow us to give physicians more confidence in diagnosing heart murmurs in their patients. And this is very important because 40 to 50% of all primary care doctors who listen to people's hearts every day don't know how to distinguish different types of murmurs. So this has been borne out in the literature. And it's not that they're bad doctors, it's just that they spend so much time taking care of so many different things. It really takes a specialized ear to be able to identify some of these murmurs. And the Echo Health people with the Echo Duo stethoscope and the Littman Core stethoscope really do help us go a long way to giving them the confidence to be able to diagnose people with structural heart disease, specifically heart murmurs. And also Boston Scientific has been gracious enough to give us a grant for their Closing the Gap program, which is an initiative designed to identify and educate people with heart disease like atrial fibrillation and heart failure at earlier stages in the disease process so that we can take care of them and allow these people to live longer, healthier, happier lives.
Wow, that's incredible. The technology and the partnerships that you have to support HeartSense and the work that you're doing.
is fantastic. And we have long had a relationship with Medtronic Corporation as well. They were our original supporter with our murmur disparities program, where we identify heart murmurs and take technology to people in the community that is disadvantaged in ways in which we never could before. And it is a really great project, and we are grateful to the people at Medtronic for having the vision to be able to support us in that endeavor.
Great.
Especially since it's Black History Month too, and I think it's doubly important for that reason.
Yes, that is definitely important. Brooke, did you want to add anything about your partnerships?
Yes, so we participate in Valvular Heart Disease Awareness Day on February the 22nd. We partner with National Alliance for Aging to help promote this day simply by putting a table down in the foyer of our clinic or our hospital to provide education to the community about heart disease. We also promoted American Heart Association's Go Red for Women by taking a video and placing it on Instagram to talk about how important it is to know your risk factors for heart disease.
And you had mentioned in that video, if other people want to check that out, we did that on February 4th for HeartSense's Instagram and Facebook and also LinkedIn. Brooke, you had mentioned the 5 important health numbers. Can you remind us what those are?
So there's blood pressure, your BMI, and HDL and LDL cholesterol, keeping these numbers low, but also being aware of what your numbers are by visiting your primary care physician, and also your weight by monitoring your BMI and keeping a healthy weight.
Great. So let's see, what are the most common indicators for heart disease? What are some symptoms of these indicators, and do they differ by gender, by ethnicity? I'm really curious. Let's start with Dr. Keller.
So one of the things that we try to get patients to understand is that there are a lot of risk factors for heart disease. And there's some of them that you can control, and some of them that you can't control. The ones that you cannot control, we call them non-modifiable risk factors. Things like you can't pick your parents, so your genes are your genes, at least at this point. So the cholesterol is mostly genetic, how you metabolize cholesterol. So you can't pick your parents, you can't pick your sex, and you can't pick your age. These things are progressive and they're dyed in the wool. We can't change them. There are a lot of risk factors that are modifiable. As Brooke mentioned, knowing your cholesterol and keeping that down, your weight, not smoking, and not smoking. That's one of the most important things you can do for yourself. Also taking your medicine and seeing your doctor as you're prescribed by your doctor every year. Those are very important modifiable risk factors, and we have to try to accommodate them as much as we can. The symptoms of heart disease, a lot of people don't realize that you don't necessarily have to have chest pain to have had a heart attack. And in fact, about 50% of women who have a myocardial infarction or a heart attack don't have any chest pain at all. And it's even worse in people who have diabetes. So we have to get people to understand that you don't necessarily have to have that crushing chest pain, but sometimes you can have shortness of breath or decreased exercise tolerance or heart palpitations. All of these things are indications that you could possibly be having a heart attack. And the most important thing to remember is that if you have a family history of heart disease, that you should get checked every year by your doctor, because a lot of things, if we catch them early enough, you will never have any of those symptoms.
Wow. Oh my goodness. I mean, I feel like for a community member that wouldn't know, you associate some type of heart attack with that chest pain that you had mentioned, but the fact that a lot of people don't experience that is something really important to note. So thank you. Yes. Brooke, did you have anything to add?
Well, I just think it's important for women to be reminded about how we need to take care of our bodies and pay attention when something just isn't right. You know, we tend to focus on how everyone else around us is feeling, and we forget about ourselves.
That's a really good point. And another question, how does it affect by ethnicity, those particular indicators of heart disease?
Yeah, that's a very interesting question. You know, a lot of the issues that we have with heart disease in minority populations and poverty-stricken populations have more to do with presentation than they do with biology. And so it's important for people to know that if you have any of these issues, you need to go to the doctor sooner rather than later. Minorities in general tend to present later with heart disease, and they present with more complex disease because of the fact that they present later. So consequently, they have worse outcomes just because of the fact that they take so long to present, and they have problems for a long time before they actually go to see their doctor about it. So this is a very important point, because especially if you have a family history or someone in your family who's had heart disease at a relatively early age, it's important to know that the quicker you go to see a doctor, the sooner you go to see a doctor, the more likely you will have a positive outcome and be able to live a long, happy life.
Wow, that's really interesting. So can you comment, going on to that note of the community and those disparities, can you comment on the racial health disparities when it comes to your heart health, and how prevalent this is in the South where you are, such as Baton Rouge or Lafayette, Louisiana?
Yeah, there are a lot of issues, as I mentioned, related to access to care, especially with structural heart disease, but certainly with heart failure as well. And the cultural and social determinants of care are eminently important, especially in patients that have large minority populations, large rural populations, and large populations of people that live in poverty-stricken areas. And we saw this with the COVID pandemic, with the testing and vaccination sites being in more affluent areas, as opposed to in areas that are communities that have some disparities. But it's not just true about COVID, it's true about heart disease too, because the same people that don't have vaccination and testing sites to go to don't live in proximity to doctors. And we did a recent community heart screening in Baton Rouge at St. Joseph's Church. And it was remarkable because one of the primary care doctors there, Dr. Ronald Andrews, remarked that he didn't even know if there was a doctor that had cardiology experience anywhere in the zip code where we were having the screening.
Oh
so
my
it
gosh.
is very common in places that have a high degree of poverty and rural areas to have no access to cardiologists or people with specialized training. So that is a disadvantage that is not related to the disease process, but related to access.
Related, yeah, to access. And what you are doing at HeartSense and with Dr. Andrews, such as like one of your partners that also volunteers at these pop-up clinics, is so important to the community, especially knowing they may not even have someone with that subspecialty of care in their zip code. Wow.
Yeah, it's amazing. Echo and the Butterfly Network have given us technology that is portable. So we can take machines that used to have to be wheeled down the hallway at a hospital and attach them to an iPhone and get quality images on the iPhone. And this allows us to be able to reach and count a lot of people that would not have normally been counted. People who don't have transportation to be able to get to a doctor at a hospital, people who are fearful of the traffic in the big city, or they don't have any access to housing for their family members when they have to go into the hospital and they're scared, or just access to advanced technology. Now we can take this to people and meet them where they are and touch people in their own communities and give them confidence in the medical establishment that may have been eroded over the past several decades by their distrust in the medical establishment and research. So it is really opening a lot of doors for us, and we really appreciate Echo and Butterfly and Medtronic and Boston Scientific for helping us to reach people that we couldn't reach otherwise.
Yeah. Brooke, did you want to add anything about the experience, I guess, with the most recent pop-up clinic that you guys did?
Oh, it was fabulous. Just seeing the people smile when you talk to them about their heart. You know, they find it very interesting to actually see their heart rhythm on your phone, and feeling comfortable about asking questions about their heart health. You know, a lot of people have that white coat syndrome where their blood pressure goes up and they're anxious or they're sweating, and when they're at the doctor's office, because they're so nervous about, you know, what they're going to be told, or, you know, and they're just nervous in general, and they forget to ask the important questions. So it's nice to just be in a comfortable space with people in the community, and just talking about their heart health with them.
Wow, that's incredible. And I know also Echo did a Frontlines video recently that premiered. I think maybe it was last week. So if people get a chance to watch that, you'll be able to see Brooke and Dr. Keller and volunteers of HeartSense in action. So how can we improve our heart health? And what are steps that someone can take to ensure they have that heart healthy lifestyle? Let's start with Brooke
first.
Yeah.
So like Dr. Keller said, stop smoking, stop smoking, stop smoking, is probably the most important thing you could do to protect your heart. Losing weight by exercising 30 minutes a day, whether it's walking or getting on the treadmill or the elliptical, at least 30 minutes a day. Eating healthy. I like to tell people, start in the grocery store, on the outside of the grocery store. So fresh fruits and vegetables, you know, make your run around the outside, and get your chicken and your lean meats. And then if you need something on the inner aisles, you know, be cognizant about what you're picking up and putting in your cart. You know, staying active lowers your blood pressure. It controls weight gain. Being active and exercising pumps more oxygen to your heart. It reduces stress. Stress is a huge risk factor for heart disease, especially in women. So monitoring your cholesterol numbers too, and seeing your primary care physician once a year or on a regular basis is very important.
Yeah, that's a really good point, Brooke, to make sure that you pay attention to what you're putting in your body. And there's so many foods on the inner aisles, as you describe them, that have things in them that aren't necessarily good for you, especially if you have a history of heart disease. One of the things that people don't realize is that carbonated beverages have so much sodium in them. And they also have phosphoric acid, which chelates all the calcium and takes the minerals out of your bloodstream, makes your bones weaker, makes your heart weaker. So if you have any history of heart disease, try to stay away from carbonated beverages, because they could be giving you hidden salt intake that you don't necessarily realize.
And that's even the diet beverages, correct?
Yes, ma'am, especially the diet beverages.
Wow. So just any carbonation is probably not the best option for our bodies.
Probably stand to have some carbonated water, but
carbonated water is safe. Okay.
And beer is safe too, in moderation, because it does not have a lot of sodium in it, but it has alcohol, which is similar.
That's actually really good to know, because yeah, I was kind of curious about that carbonation even with beer. So that's interesting. Wow. So does HeartSense have any pop-up clinics coming up in the next few months?
Yeah, so we are developing a series of pop-ups at a community clinic in Lafayette, Louisiana, and we're looking for partners. So the way that we organize our project is we want to be a support system for organizations that have healthcare missions, fraternities and sororities, community centers, churches. So if you have a church or a community center or a group of people that has a healthcare mission, we would like to come and support your mission. We will bring all of the technology and the personnel to come and allow you to be able to help the people in your organization or your community find out if they have structural heart disease and heart murmurs that they don't know about, blood pressure problems, and blockage in any of the arteries in their body. We do carotid artery screenings and atrial fibrillation screenings, as well as heart murmur screenings. So we are actively pursuing partners to be able to help us complete our mission by helping you complete your mission. So don't hesitate to give us a call. You can find us on www.heartsense.org and also on the email info@heart-sense.org or on Instagram and Facebook. So please do reach out to us and let us know how we can help you to help your community.
That's fantastic. You heard it first, guys. So if you are a community member that's somewhere in the area of HeartSense and you want to host these wonderful screenings in your community, let us know. That would be super helpful. And we are also going to post at the end of this fireside chat all of that information so that you can contact us. So last question for our fireside chat. It's been wonderful talking to both of you. But where can someone get resources and learn more about living a heart healthy lifestyle beyond American Heart Month and all year long?
Thank you for having us, Sabrina. This has been really fun. I hope to have more fireside chats with you and Dr. Keller.
Yes.
Our listeners can go to www.heart-sense.org. Our website has tons of great information about heart disease and heart healthy living, and also some great resources for kids. We have a contact button at the bottom of each page, so you can contact us if you would like to host a local screening.
Great. Well, thank you both so much, Dr. Keller, Brooke. This has just been wonderful, and I look forward to doing more chats in the future so that we can get those community questions that people have answered and in a comfortable environment for them, which right now is virtual, but that might also be your comfortable environment in your own community. So again, if you are in Baton Rouge or Lafayette, or you think it's possible for HeartSense to come out to you, then reach out to us at info@heart-sense.org. Thank you so much. This has been HeartSense with Dr. Antoine Keller and Brooke Everett, and I'm Sabrina. Thanks. Bye-bye.
Thank you, Sabrina. Bye-bye.